Hey friends, thanks for joining me, Jim Baroud, to hear a few insights from leaders who represent our innovation ecosystem. Today's chat is with Karin Stephan, the co-founder and COO of Earkick, and Dr. Harvey Castro, physician, entrepreneur, and former healthcare system CEO, as well as a generative AI and healthcare strategic advisor.
I'm an entrepreneur. I'm a founder in deep tech. And my company is called Earkick, you can see in the background. And we're all about using technology and AI to support mental health of everyone.
Wonderful. Harvey?
I call myself a little bit of a nutty professor. I do three things. One, I give talks on AI and healthcare. Two, I advise other companies on that. And then three, I'm having fun creating my own AI healthcare products.
Awesome. Okay, so Karin, let's go back in time here. Tell us about your sort of journey.
Well, I was always entrepreneurial, but in my first early years, I was a professional musician. I built my first company in music, music sales, education, and that in my early 20s. And I had that company for a long time. It still exists, not with me anymore, because I had moved on deeply into management psychology and digital transformation. It took me, across different countries. And I ended up in the place where I'm now because the time was right. The problem is global, and I can see we can tackle this mental health crisis we're living now with the help of technology and with the help of humans like you and me and everyone who wants to do something.
Great. And what type of music were you focused on? What, any instrument, or was it singing?
No, I was a pianist, a keyboard player. And I played everything from classical to jazz to shows to rock and roll, even some heavy stuff. Just mostly live music, which is what, connects me to the audience most, and that is really most fun to do.
What type of music do you like to listen to?
Haha. So much from Latino, because I'm half Colombian, so I love Latin music, to again jazz, singer-songwriter. I love listening, for example, to Noah Kahn, who's singer-songwriter from Vermont. But I also like classical music, and I like country music, and I like everything that kind of conveys a lived experience and combines lyrics with tunes that express something that is not possible to express in words.
Great. And the company that still exists, what does that company do exactly?
It's called the Music Factory, and it sells high-end equipment for studios. It's a studio as well, very high-end. It's a school, and it's also, like everything concerning recording and producing music.
Great. I'm going to follow up with you. One of the companies I work with does 3D or spatial audio. So I'll send that information. I'm sure you'll find it really interesting if you don't know it already. Okay, Harvey, go ahead, Harvey. Talk to us about your background and where you're located, actually. I know Karin is in Switzerland. Where are you?
I'm in Dallas, Texas. And I got to share this quick story. It's November 2022. I'm literally playing with ChatGPT. I had literally just came out. And I was blown away. I said, this is going to change healthcare. This is going to change the way we do things. And so I was so excited. I literally wrote the first book, and I was out within 3 weeks on how to use AI in healthcare. And so that kind of gives you an idea of where we're going. What I'm doing now that I'm really excited is, how can I combine AI and healthcare to create better healthcare for patients? And I'm working with a company called Help AI. And what we're focused on is creating, I call it an AI that is over your patient bed, and it's specific for patients that are at fall risk, because unfortunately, if they fall, break their hip, mortality, whatnot. And so the AI is literally watching the patient, and I know that sounds weary and kind of scary, but if the patient's a fall risk, it says, hey, it'll do predictive analytics, like she's ripping her IV or making a motion that she's getting out of bed. then the AI will immediately call the doctor, the nurse, saying, hey, somebody needs to come, but simultaneously will speak to the patient in their language and say, hey, Miss Jones, or in Spanish, por favor, or whatever, and say, what's going on, and kind of start talking to them, see what they need. Simultaneously, they're coming. And that alone will help prevent falls. So I'm really excited that's one example of something I'm working on.
Oh, that's awesome. But you do you've been doing other stuff along the way. Where were you? Where did you come from? You're obviously a doctor, I think.
Yeah, actually, I was born in your neck of the woods. I was born in New Jersey. Grew up in New York City. Was blessed to be in the U.S. Army, and I have this heart to serve. So I became an emergency room physician. So I have 20 years of emergency medicine experience. Simultaneously, I'm the type of person that if I see something that I really want to fix, I jump on it. So real quick, I was in the emergency room coding a patient, and this was when the first iPhone came out. And I thought, man, why are we taking forever to get medication? So I thought, man, what if I make an app and you just tap 3 times and boom, there's a dose. So I was the first person in the world to make that kind of app. So that's kind of stuff that I do.
Oh, that's exciting. So technology, medicine. That's a great combination. So you really, as you're a practitioner, so what works and what those problems that need to be solved. That's great. Okay, so Karin, let's talk about Earkick. So talk to us about how that got started and where you are now.
Yeah, so it got started because we have been having the same problem for decades, that we don't know where we're at with our mental health until it becomes really bad and we have to go seek help from a doctor. And then the whole journey starts of waiting rooms and unclarity and kind of this really sad story for so many people. So we figured we have to empower the end user, people like you and me, to measure mental health in real time, at any time, really effortlessly, and then be able to use that data and interact. So Earkick does all 3 of them. With Earkick, you can measure mental health in real time. It's really effortless within seconds. It gets assessed while you speak, type, or video. And then you get a reply. You can interact with this little panda that you see in the back and talk to it, type to it, like with a very good friend. And so the whole mental health support, the whole awareness, the whole journey comes out of that dirty, sickness corner and becomes part of my daily life. And that's the best way to keep me, for example, out of an ER where Harvey would have a hard time, having all these kids and people showing up because they have panic attacks and whatnot. So identifying early signs, which Earkick can do, then interacting in real time with actionable suggestions in a way that people love, and they feel empowered. Oh, I can do something, and there's a way out of this. That's what our mission is, and that's why tens of thousands of people using Earkick love it.
Just hold 1 sec. Someone's at the, I'm just going to pause this again. So then, Karin, what is your vision for Earkick going forward?
My vision for Earkick is that everyone, and I mean all 8 billion people, have access to a solution like Earkick, that they can own their challenges and they can learn with Earkick. They can have, at any time know where they're at, and they can really rise to their potential, be the best version, the most authentic version of themselves. And just by, having a little help from AI, from technology, that is the vision. And this can go so far. It's not just mental health. There are so many things, little challenges that grow into huge avalanches that we can catch early and tackle early. And therefore, again, it's the empowerment of the individual.
Got it. And so where are you in the stage of the company's growth? Are you still fundraising, or where are you? Just in case there's investors listening in.
Well, we currently have a very, very exciting opportunity to be part of our current SafeNote extension. And approach me if anyone is interested. We are really now all growing. I just said that we have tens of thousands of users. We have been seeing a month-over-month growth of 45%, which is amazing. People love the app. You can go on the App Store and see what they write. And we get, every day we get messages from people, who say we saved their lives, we made all the difference and all that. So really, we're ready to grow and scale huge and big. And anyone who wants to be part of that mission, let me know.
Wonderful. Okay, great. And so let me ask this, Karin, is there competition? I mean, I think there is. So who do you see as competition, and what worries you these days as you grow this company?
Yeah, well, there is always competition. What worries me is that people who don't have this opportunity to measure and then go on a safe way to tackle their mental health issues, and I'm talking especially about young people, youth, they would probably turn to TikTok or, key into ChatGPT, things that don't belong there. And they will get maybe an answer that makes things worse or that doesn't really satisfy their needs. So some people don't, they think that Earkick is a chatbot, like, let's say, Wysa or Wobot, which in their own right, they do their thing. But what we need to emphasize over and over again is a chatbot only chats, has no memory, cannot generate content and answers on the fly, and is not going to remember you with all the data that belongs to you. Earkick is different here. It's very focused on mental health as opposed to ChatGPT. It is private, like there you don't have to register at all. You can just use it, and it remembers you, and it uses this measurement capability to really talk to you, just you. You're not going to get off-the-shelf answers. You're not going to get some decision tree things. You're going to get answers and interactions that are really based on your own data. Of course, maybe there is a solution that does very advanced AI chatbot things, but as far as I know, nobody does the measurement, assessment, plus interaction or chatbot the way we do it, while being radically private. So there is competition. I'm glad there is, but I think we're ahead of the curve in many ways.
Great. And this is not to take the place of a real life therapist, is it? Or does it complement, or how do you see it for folks who, might already have a therapist or, are waiting for a therapist, because there's a shortage everywhere these days?
Yeah. I wish we had enough therapists. I wish we had all these people that are needed. And by no means are we trying to take anything away from that. We're augmenting them. We're enlarging or augmenting their presence into people's lives. What happens in between sessions? Earkick can help. The therapist or doctor can look at the data, can have a much more sophisticated conversation based on data with the patient. But I also have to emphasize here that the majority, actually more than 50% in the US, don't have the luxury of seeing a therapist for many, many reasons. And for those, we want to be there. Then there are people who are not quite, there. Their problems are maybe a little smaller, and they feel bad about taking the spot of someone who's really in a severe crisis. And these people are really thankful. They write to us that they can use Earkick so effortlessly in the everyday back and forth, and they don't feel like they're a burden to someone else or a burden to the system. So there are so many ways Earkick can be there and actually improve what's already there, augment it, give people a choice, and just play to the strengths that AI and technology can bring to the table.
Got it. Okay, so Harvey, talk to us about what you mentioned that before you're working with a company that helps with fall prevention. But what else are you working on and have you been working on over the past few years leading up to today?
Yeah, in full disclosure, I did some research on mental health and how to use AI and your voice. And your voice is really powerful. You know, believe it or not, some people don't know this. If you had the right algorithm, you would be able to know roughly what my sugar is just with my voice. This camera stream that's coming through, you'd actually be able to tell my blood pressure, my age, my hemoglobin A1C. And so when I started doing research, this is kind of where I bumped into Earkick and my mind blew up. I thought, oh my gosh, this is going to be amazing. I agree. Mental health care is so big. And my full disclosure is I actually invested, I think it's over a year now for sure with Earkick. And I'm glad I did because I know it's going to change the lives of humans all over the world. Now, as far as what I'm working on, is exactly what I just said. It's AI in healthcare. I'm having fun creating my own products, but I'm also helping others. I think in humanity, as we're given all these gifts, it's so important to give back. So I'm spending a lot of time with hospital systems explaining how to use AI. I'm teaching doctors how to use AI because it's a whole culture out there. Some people want it, and some people hate it. And so going out there and giving that word, and then taking my entrepreneur spirit, my heart of serving others, how can I combine the two? And that's what I'm doing now. So I'm excited about helping companies like Help. I'm actually one of the partners there. I'm excited about coming up with some new products. One that I probably shouldn't announce, but I'll announce because I'm not worried. I'm creating a LLM, and the LLM it was inspired because I'm constantly going out there giving talks. And so what I'll have here in the near future will be an LLM that I can upload any video and it'll give feedback. Harvey, you're speaking too fast. Hey, Harvey, you're not using your hands. Hey, Harvey, you're not looking at the camera. All these things. And then within seconds, I'll get an email giving me exact tips of what I'm doing, what I can do better. And so that's something I'll have here out shortly.
I love that. Please share that when that's ready. Now, how did you connect with Karin? I know you mentioned earlier you haven't met in person. So talk to us about how that happened.
You know, probably Karin has better memory than me. I think it was through LinkedIn. I think I found her company. I don't remember. Karin, you help me now.
Yes, we met in a community, in a Slack community. Harvey's always at, like where new things are. And so am I. And so he was, like commenting. He's a very giving person. So when someone asks something in a founders or health tech community, he's the one out there sharing resources and asking good questions. And so that's where we connected, Harvey. And then also, of course, on LinkedIn. And we immediately, had this common passion. And then we also found out that our background, Colombian, is the same. And so it was a no-brainer.
Yeah.
Got it. Okay. So you both are working on some fascinating stuff. What, the mental health, landscape is challenged. So let's talk about those challenges right now. How do you see it? I know you're both in different parts of the world. Where is it? And then let's talk about the challenges and maybe the opportunities. Obviously, you're working on great solutions, both of you. So talk about how you see the landscape or the environment right now. And we could start with Harvey. Go ahead, since you're in the States.
Yeah, it's funny. In my mind, I was thinking it'll be interesting. I can't wait to hear what Karin says because she's governed by the GDPR. Here in the States, we're governed by the HIPAA when it comes to healthcare. And so with that said, we share the commonality that we want to make sure that this data is secure, that this data is private, that we're making sure that these algorithms is not quote unquote being trained on our information. And if it is, that it has our consent to do so. And so where I see this moving forward is I'm personally concerned of two things. On the consumer side, I'm worried that they don't realize that AI is being used in healthcare. They don't realize that their information to some extent is being used, and that for their care it's also being used. So I'm a real big proponent that we need to be transparent with this information, so that when I go to the doctor or hospital, that I know how they're using AI, what they're doing with that information. Because honestly, when you go to the doctor and you sign all these forms, in those forms is that they're using AI, or that they have the liberty to use technology, and you don't know what that means, because we're all in a rush to go see our doctor, so we're just signing quickly. And so number one, I want transparency, and I think we need to hold that true. Number two, I'm worried about the biases in these algorithms. If people don't understand how this works, they're going to start doing it and using it wrong. And I'm personally worried that they're going to start hurting themselves without realizing that they are. And then the last thing is, I'm also worried that healthcare professionals, again, if they don't realize that this information may be biased or may be wrong, that they may perpetuate that same error that's in the data set, not realizing that they're doing that. So sorry, that's kind of long-winded, but that's kind of how I see this area growing.
No, that's great. Go ahead, Karin.
Well, our company Earkick is in the US, so that I'm also talking more to the US case. Although I have to say, the prevalence, that lack of access to mental health support, it's the same everywhere. We're all having a huge problem. That's why we are in a mental health crisis, especially young people. 1 in 2 have or will have a mental health issue, and they only live once those formative years where it's so important that they get supported. My concern is around that they don't they don't have time to wait until everything is kind of discussed to the dot. They may not even be part of the discussion, or they don't have a seat at the table to say what's important for them, what's helpful for them, what they need support with in terms of AI literacy. That worries me, and I think we can do much better. Also, there's mental health, there is AI, there is tech, there are systemic problems, there are lots of incentives that are wired the wrong way. And, there are so many struggles going on, and I worry that we don't find a common, table to sit and, come up with solutions that will not be siloed. I share some of the concerns that Harvey just mentioned, and that's why we made Earkick so radically private that there is no misuse or any danger that could happen for your own data. And we also make sure that it is unbiased by having the quality of the data and the way it's worked with very, very, very high standards, respecting what the responsibility that we have. Where I see the opportunity, though, is that we can really, really tackle the mental health crisis now. And we can tackle it in a timely manner so that the current youth is not going to lose their years, their best years, to challenges that could have been prevented. I also think that we can set the incentives and the frameworks in a way that there is a win-win situation, and not that there are the ones who profit and the ones who kind of don't know and are taken advantage of. And so what matters maybe most to me is that we all get involved in whatever capacity we can, that we all put our hands into AI, into tech, and get a knowledge about it, get involved, discuss, have this conversation, not just the dystopian group here and the overconfident group over there. No, we really, really have to get this, have a solid and robust discussion. We have to get actionable, because AI is here to stay, and we want to really tackle the huge global pandemics that we're living now and that we may have in the future in a way that makes sense and that includes our voice and technology.
Right. Yeah, so important. And now what about ages? How early is Earkick applicable for kids?
Mm-hmm. So it's for teens from teenage years on, 13 plus. And the way it's currently used is, kids that are younger that we know use it with their parents. And that's a good way to really learn and to understand things. But the majority of people who use it are a little older. They're students, high school, college, university, and young professionals up to any age. And so I think it's available for free. A very, very full version is available for free. There is a paid version, a premium version with more options that would include some payment, but we made it in a way that someone who's in crisis or really needs some support can get the app without registering, without paying, and immediately profit from it.
Oh, that's great. And talk us through how a parent would use it, because as there's so many young people that need help, and the parents need to be involved, obviously. But what does that sort of look like?
Yeah, so typically, we have like Spotify, we have like a family sharing option. So the father, mother would download it and then share it as they see fit with their kids, so they can all use it on one subscription. People are taking advantage of this. I hear from mothers who, prepared whatever they need to talk, whatever robust discussion they have to have with their teens or with their kid. They kind of discuss it with Earkick first to make sure it's not too intense or emotional. And the kids, when they have anger or they need to vent, they also use Earkick to kind of, organize their thoughts and be more structured in what they want their parents to know. So that's how it's used. I hear it creates more clarity, and it prevents a lot of misunderstandings, because very often, and that's not at any age it's the case, very often we say things that we later regret just because we were in a very high emotional place, or because we didn't have clarity about what's actually going on. So you could think of Earkick as a way, as an intermediary between people who actually care about each other, but sometimes don't find the right timing or the right words or the right approach to discuss things.
That sounds really great. I'm so happy you explained that. Harvey, did you want to add anything as far as how you see Earkick?
Yeah. I love what she said, that it's available to those that are in crisis. As a physician, you're gonna laugh at this. I had a hard time when I got my first paycheck, because I said in my heart, I'm like, I would do this for free if I didn't have any bills. I think it's important to make sure that we use the talents that we're given and give back to the community. And I love that she made this available to people that are in crisis. We want to avoid people hurting themselves, suicide, mental health. And unfortunately, if they don't have the funds, it shouldn't be neglected. And so let's help. And so I love that. I echo that she's doing it. I'm happy even more that I'm an investor with her, with this company. This space it's really delicate. People don't want to admit that they're having issues. They don't want to talk to others. So giving a platform that allows for someone to reach out and speak and talk, and then be able to give that information to the provider and track that information and see trends. It's so important. We live in a society that is, we want quick answers, but we also live in a society, especially in the States, that it's healthcare, but it's more like sick care, where we're addressing it when it's already too late. And the more preventive analytics that we're able to do, the better as a society, because then both for the patient and for the physician. So awesome.
Yeah, no, that's good to hear. So we usually have a just one thing during our podcast conversations. And so I'd like you to respond to this question, both of you. So one tip for entrepreneurs leveraging AI in healthcare.
Explore the development of multimodal AI systems that combine various data sources, empower the end user, and create something that empowers them and that they can love and use every day.
So one quick way that entrepreneurs could use AI to leverage, I say use it for their website. The way we speak to our patients, it's really important. If I'm a diabetic doctor, then I should use the correct words for my population, but let's use AI to make sure that that translation is done correctly. And then me as a human, let me verify that everything's correct. So I think that'd be a great tip.
Perfect. Great. Okay. Now we'll do the one. What about one tip that we as consumers can leverage AI to improve our health? Harvey, go.
So as a doctor, unfortunately, I only get 13 minutes. That's the average time that we get with our patients. So I tell my patients before coming to see me, type in all your questions, what you want to ask, and what should you ask, and then formulate those questions, and then bring it with you. And then let's have that computer open together, and let's interact with AI and give you the best healthcare.
Great. Karin?
Make sure you use AI where it's strong. It's 24/7, 365. It can hold your feelings, it can hold your thoughts, it can interact with you, and it can empower you to understand yourself better. Do that.
Wonderful. All right. That's great. All right. This has been a great conversation. Thanks so much, folks. All right. We usually end with a poem or a quote or a saying. So Karin, ladies first. Well, let's start with you.
I'm guided by this one. Every day I get up as an entrepreneur, but also as the North Star for what I'm building. It's by Maya Angelou, and it's do the best you can until you know better. And then when you know better, you do better.
I love that. Harvey?
So I'm going to cheat and you're going to laugh. I have a Vista board, and every day and every hour, the Vista board gives me a different message. So I'm going to take what it said today. It says, sometimes life hits you on the head with a brick. Don't lose faith. Steve Jobs.
Nice. That's a great way to end. This has been a great conversation. Thank you so much. Thanks for joining us. I hope you enjoyed the show. Please like it, leave a review, and subscribe. See you soon.